Derick Mitchell, the CEO of IPPOSI, has been with us from the start of the journey and has consistently put the patient agenda forward. And even this morning, we had a meeting earlier this morning, and Derick was saying, where's the patient in this? So he's a constant reminder. The reason we're here is about the patient. So please welcome Derick Mitchell, CEO of IPPOSI, to the phone.
Thanks, Martin. Good morning, everybody. I'd like to echo all of the congratulations and sentiments to particularly Annette and Martin for really driving this through, and for all of the academic partners for really coming together around certainly a very, very innovative program. It's great to be here from delivering a patient perspective, and it's great to be involved with the program in terms of its ultimate rollout. The organisation that I'm here representing is IPPOSI. That's the Irish Platform for Patient Science and Industry. We're a patient-led platform, and we've been working in this whole area around health innovation for a number of years. And the way that we operate is that we're patient-led, we're patient-driven, and we focus particularly on speeding up access to health innovation. And we do that through consensus, we do that through dialogue, and we're a platform where patients can engage with the different arms of the health innovation process. We particularly focus on patient education because, as has been mentioned many times today, that the power of education in terms of the transformative nature of it, not only on patients but on the healthcare providers who are working with them in everyday settings, is absolutely key to how we're going to shift left and stay left. So the kind of initiatives that we've been focusing on this year have all revolved around what we call patient data. And there's a number of initiatives that we're following through on, and I'll talk to you a little bit about them. But I'll also talk to you about some of the patients that we've been training and that we are increasingly seen involved in decision making, not only in healthcare service design and provision, but also around research and innovation. And really the question I get asked quite a bit is around, well, how could patients possibly understand, or why would it be so important that patients have an information literacy? We talk a lot about patients' health literacy and digital literacy, but in terms of information literacy and why that's important, I think it's been borne out in many recent months and years around the importance of educating not just the patients but also the public around decision making that's made often on behalf of patients but without their input. So thankfully we've seen an increasing number of involvement opportunities for patients around the design and the redesign, and indeed the transformation of certain services in the healthcare setting, and indeed I see Darren from HRB is here as well in terms of the research and innovation setting. There is an increasing amount of opportunities for patients, and what we see is that's a very, very welcome transformation, but patients need to be supported in the roles that are there for them, and we need dedicated, sustainable frameworks of engagement whereby they can do this in a more real-time, in a more patient-centered way. So we want to see the situation where not only do patients have access to a summary of their record, but they actually get to use that data to drive their own improvements in their own individual care, and indeed for the care of other patients and the public. So we've seen, and again, it's great to see the likes of Paul and others from the HSE, because we see patients now at the national level serving on decision-making committees, on advisory boards, on different technical groups. There's a lot of these opportunities that are being created for patients, and it's extremely welcome. And we see the whole digital health space as being absolutely ripe for these kinds of new opportunities for patients. And we've run a number of interactions and workshops with patients and other stakeholders in terms of, well, where are those opportunities at the national level in terms of the design and the redesign of these new digital health solutions. And we definitely see the education and training programs, that the Masters today, as one key opportunity for patients to get involved. So, as I said, we've been training and educating patients on aspects of health innovation for a number of years, and we've learned a lot from our experience through what's called the European Patients Academy, And we're bringing that to Ireland in terms of the methods, the interactive nature of the blended learning approaches that are being used on topics such as clinical trials, regulatory affairs, and health technology assessment. And we have a package now that is the start of where we can start rolling this out in other areas. And we see digital health as absolutely perfect for the next stage in this. And our involvement in the programme will hopefully develop that kind of content, and we can work with the likes of the HSE and the other academic partners to deliver content that's appropriate for patients. So we've got, by the end of this year, we're going to have a cohort of 45 graduates from our existing programme. And those are we treat them like precious eggs, because we don't just sign them up for different opportunities that come to us maybe late stage, or we actually develop meaningful opportunities for them. And thankfully, as part of the MSc programme, we're going to work with the HSE and the education partners to develop those opportunities within that programme. And a lot of our patients are coming to our upcoming conference on electronic health records. It's on October 7th, and we have a rich lineup of speakers, but also hope we get some of that dialogue going as well. And I would encourage anybody to go onto our website and to sign up. It's actually open to the public, and we have a number of spaces left. And as part of that agenda, 3 of our, what we call our expert patients, are going to be talking about their experiences. And I'd like to just introduce them today, because it comes back to what we talked about and what Paul mentioned about bringing things back to, well, what are the benefits, not just for the healthcare professionals in terms of the efficiencies and other benefits from the point of view of workflows and that from digital health, but what are the benefits for patients, and particularly those patients who maybe have either complex or chronic conditions, who are accessing different services in different settings. And Jackie Brown, Caroline Murphy, and Sheila Fitzgerald are the embodiment of that kind of cohort of patients who have very rich experience of dealing with paper-based systems and being the key, I think, educator for an awful lot of the healthcare professionals in terms of not just their own condition or their own experience, but the experience of others and how that can be applied to different ones. So those 3 are my heroes. I get to work with them on a regular basis. And as I said, I want a whole army of people like that going out, becoming more involved, because what we definitely see, and it's been mentioned already, is that the confidence that comes with just enough education to perform is something that is almost an intangible benefit of something like the current MSc. And we've seen it among our patient cohort. So I'd just like to say, as part of our event on October 7th, we're going to be producing what we call the first edition of what we've tried to do in terms of a terminology explaining. Because when people talk about digital health, and they talk about e-health, and they talk about electronic health records, it means different things to different people, depending on where you're coming from. So we've got a first edition of this terminology explaining document, and hopefully that will lead to, I think, much greater consensus about what we talk about when we talk about digital health. So thank you.